Hello and welcome to this fabulous edition of CTSNet Global. In CTSNet Global, we love to talk to surgeons from all around the world, and I'm absolutely delighted to be joined by Dr. Glib Yemets. The reason we know Glib is here and is really pleased to meet him is that he has just submitted an absolutely fantastic video to CTSNet. But the thing that really struck me is that Glib works in Kyiv in Ukraine. He works at the Ukrainian Children's Cardiac Center, although he is mainly a cardiac surgeon. So perhaps I'll start by saying hello, and then maybe Glib, tell me a little bit about yourself, where you trained, and a little bit about your center.
So hello, thank you again for the invitation, and that it was possible to publish our video case. So I'm working at the Ukrainian Children's Cardiac Center Department for Adults. I'm the head of the minimally invasive cardiac surgery department in this center. And I'm personally and our department, we are performing minimally invasive cardiac surgery, such as total endoscopic mitral tricuspid valve surgery, direct view aortic valve replacement via right thoracotomy, minimally invasive coronary artery bypass grafts for patients with multivessel disease. And cardiologic side, we're doing the TAVI cases from the surgical side. I was graduated from university in Kyiv, from Bogomolets University. Then I ended the internship here in Kyiv. Afterwards, I worked as the resident in Zurich Hospital and university clinic there. And then I came back and established work in the way of minimally invasive cardiac surgery in Kyiv, because at those time it was a new branch of cardiac surgery in Ukraine, and now we are already performed around 500 cases with a minimally invasive approach.
So that's fantastic. So I would love to hear all about that video. But first, the reason it really jumped out is I was amazed at the level of surgery you're doing in a war. And I'm sure everyone around the world would just love to know, what is it like being a cardiac surgeon in Kyiv at the moment? Is the war affecting your surgery? How is it? How are you getting on? I'm amazed you're doing all this in such a crisis period. But what is it really like on the ground?
Right now it's more or less okay. There was periods during the war period that was really tough. The first one was during the first months of the invasion, when the Russians wanted to get the capital of Ukraine. They tried to enter the Kyiv city, but thanks to God that happened. Thanks to our militaries, to our soldiers, that we are now able to work and to as it was before. But the first months was really because nobody really knows what to do at the moment when the war begins, because there were me as a cardiac surgeon, as a surgeon. Unfortunately, on those time, I had negative experience with the trauma surgery, because a lot of soldiers and civilians which were affected nearby the Kyiv were transported to our center. And I used to work as a general surgeon at those moments to help to survive soldiers and civilians. Of course, for me, as for a specialist, it's a great experience, but for a person, it was really hard sometimes to see young people, young healthy people that were totally, chopped, destroyed just because of stupid things. And mentally, it was really hard to understand that. But after 1 month, when they got back from the north side, from Kyiv, and we've been able to remove them from nearby the Kyiv period till winter, it was more or less okay. Then in the winter, they started to bomb our electricity centers and manufacturers which produce electricity, and we had a couple of tough weeks blackouts where there was no with the petrol generators, and thanks also to some companies which donated us the fuel to not stop the work, because we could not stop our work, like when the cardiopulmonary bypass is going on and there is no electricity stopped. It's a little bit disturbing, but thanks to God and thanks to our defenders, that now is, how to say, more or less the same as it was before the war. But sometimes there are, like this night and last month's air bombings during nights. So at the day it's more or less okay, but at the night you can see the bright sky, and you do not sleep so well as it was before. It was okay right now, not as it was at the start.
And how is it simply getting home to your house? And do you have family? And how is it for your family? And how was it when they invaded?
When they invaded, yes, I woke up at 5 o'clock because of the explosions, and I had my mother, uh, which is living nearby the Kyiv, more or less safe place. I was at that time I was living by my own in my home, so I just woke up and went to the hospital. And from that day, I was living next 40 days, 42 days hospital, because we had a lot of work. And me, as a head of the department, I was not able to leave because the medical personnel, the nurses, all other specialists, they were also living in the hospital because they're not living in Kyiv, they're living nearby the city. And they were not able to go home, so I've been living with them and we were doing our job and helping people to survive. So I was not going from hospital to home. We've been living first 40 days, the toughest days, in hospital till everything more or less becomes stable.
Wow, sounds like you've done some just incredible heroic work in your last year to help your people in Ukraine. That's just absolutely fantastic. And what's it like now then? And where are you getting your patients from all over the country? And how are supplies? And how is doing cardiac surgery right now today?
Right now, it's how it was before, but there is a lot of maybe more patient at this in comparison with the past period, because the western part of Ukraine now is moved to Kyiv. So a lot of people moved temporarily to Kyiv from the western parts and from the south parts of the Ukraine. So now we have more patients. The supply at the moment, and the United States, we have a lot of supplies from the humanitarian side, from the donations, and also our medical Ministry of Health is right now is covering most, not like around 60-70% of supplies which is needed to perform cardiac surgery right now at Kyiv. So we have no problems with that at the moment. To be honest, not so bad. So everything is okay right now.
Well, that's really fabulous to hear. So yeah, I'm going to hear all about your video you presented to us in just a moment. Just final question about Ukraine. I mean, what do you think is going to happen going forward? I know nobody knows for sure, but you know, as you living there in Kiev, what do you think the future holds for you and your country?
We hope that everything will end in our victory, because true is on our side. We will stay till the end. I do not know how it will end, but we hope that with support of almost all of the world, with the European countries and the United States, really, because for us it's life-saving support, and we could not struggle on our own with such country as Russia. It's impossible. And with such kind of support, and hope that it will end with our victory and as soon as possible.
Wonderful. And so, I mean, you have our world support. I'm sure everybody watching this video has your 100% support. And obviously, if you did want anything, you just must reach out to us. But certainly, I think one big support is that we should just support your amazing surgery. I was blown away by your wonderful video. It was a totally endoscopic redo tricuspid valve replacement. I mean, just the best, highest level surgery in the world. Maybe tell us a little bit about that video and tell us about that operation and also, the operations you most love doing.
So it was a patient because he was at the moment of his operation, open heart operation. He was 16 years old. He has a congenital heart disease, Epstein anomaly type C. From the start, he had his first surgery when he was 6 or 7 years old. It was reconstruction of the Epstein anomaly. Afterwards, he grew up till he was 11 or 12 years old. And then surgery, it was replacement of the tricuspid valve with the cylinder valve from the xenopericardium. We call it Heimlich valve because the scientist Heimlich introduced that valve, and we have a big series of those replacement with the cylinder valves even in neonates and in young adult patients. And it was his third operation. We had the total endoscopic second redo tricuspid valve replacement, neo tricuspid valve with the mechanical valve because choice for young and mechanical valve. We think so in this case to not have reduce every 4-5 years.
Yeah, well, it's absolutely wonderful video. We'll post it with this video as well, so people can see it in full. And that was great. And maybe we'll expect a few more videos from you. Is there anything else coming up or anything you've recently done that you're particularly proud of?
Yes, we started to do complex mitral valve and concomitant mitral and tricuspid valve through peri-areolar access, through the nipple access. And so right now in women, we are doing 80%. We're doing mitral and complex and tricuspid valve surgery with the peri-areolar access. So it's like there is no visual scars afterwards, after the cardiac surgery, which you can see on the patient, and the trauma, because of the 3D endoscopic technologies which we are using now, we are able to reduce trauma for those patients, and the cosmetic effect is great. So we have done around 95 concomitant mitral tricuspid valve cases with for operative mostly, for functional also mitral valve insufficiency with the implanting of neocords, resection techniques and others, which sometimes are really interesting to do. So we have a big series of those patients. And also we're doing the minimal invasive coronary artery bypass graft through left thoracotomy, which is not really common right now in all of the centers, but we also have started from 2018. So we are doing for patient with multivascular disease. We're doing both with the arrested heart from left thoracotomy and also on the beating heart, minimal invasive coronary artery bypass grafting on the beating heart. So it could be interesting for you to maybe to introduce that, because I think if to be really precise, step by step, all the necessary tips and tricks which we can post, these surgeries become much easier than a lot of people think that it's really complicated.
Well, that's absolutely fantastic. It sounds like you're already, one of Europe's leaders in minimally invasive cardiac surgery. People would be wanting to come and visit you if it wasn't for a few little things in the sky, but absolutely wonderful. Thank you so much for joining us. and I hope normality returns to you. I'm sure we'll get so much response for this video in support for you. So from all of us in CTSNet and everybody, well done with your amazing operations. We'd love to see more, and best of luck with the future. Thank you very much, Glib Yemets. It's been a pleasure talking to you.
Thank you, and thank you very much for an opportunity to be published on your resource, and it's great for our institution. We're really thankful for that. Thank you very much.